Hi, good morning. Hi, this is Paul Slackis, Good News Broadcast, speaking to Dr. Fleischman. Hi, Doctor. How are you?
I'm very well. Thank you for having me.
Thank you for doing the good work that you do. You're a pediatrician, neonatalist, and Senior Vice President and Medical Director of the March of Dimes Foundation, a wonderful organization. Plus, you're involved with many other things. And we're going to talk today, key questions every pregnant woman needs to ask her doctor. This is preterm birth, I think, is the main subject here. A new survey finds lack of communication between moms and healthcare providers, okay? 6 million pregnancies throughout a year, and 6 million preterm birth. How many preterm births are there?
It's about 500,000 preterm babies every year in the United States.
Okay, what do we consider a preterm birth?
Well, it's babies born too soon, less than 37 completed weeks. And, 40 weeks is the normal length for pregnancy.
Okay, now, what happens if a baby is born too soon?
Well, premature babies, sadly, have very many disabilities. They can be retarded, they can have cerebral palsy, blindness and deafness, and long-term problems.
Okay, so, is there anything a person can do about that, or is it more that you need to know that that possibly can happen?
Well, you need to know that can happen, but there's lots that we can do. There are risk factors for preterm birth, and women need to know them and talk to their doctors about them.
Okay, and what would some of those be?
Well, first of all, family history and history of having had a preterm baby. If you've had one, you're at high risk for having another. And then there are lots of behavioral issues. Smoking, drinking, drug abuse, and being overweight and underweight are both issues that are very serious risk factors for prematurity.
How can you determine that is a potential risk factor? Okay, so say somebody is overweight or underweight. How do you then correlate that to then the preterm situation?
Right. Well, the first thing to do is to go see the doctor even before you're pregnant, to talk about your medical history, to get your weight and blood pressure done, to do some basic blood tests, so that if there are any problems that the doctor picks up, we can deal with them before you get pregnant. And then as soon as you're pregnant, go see the doctor for that first prenatal visit, so that we can continue to address any of the risk factors and make you healthy as a woman, so you'll have a healthy pregnancy and a healthy baby.
This is very interesting, and I think very unusual. If you ate better, I guess you were overweight, as I think what your suggestion, or if you're doing some things that probably are not so healthy for you, to take some time to be responsible, because having a child is a serious responsibility prior to it, a year prior, 2 years, 3 years, right? Is that what we're saying? For people to start to really get out there, I'm going to want to get pregnant in 4 years or 5 years. Why don't I start to get myself and my body, who's going to bear a child, the child's going to live inside of my belly, to get into better shape?
We call that the life course. Young women have to begin to think about their reproductive life plan early on, and when they're beginning to plan for pregnancy, to really take seriously the discussions with their doctors.
Do traits like let's use overweight, do they, because a lot of times everybody, says, well, it's in your genes, right? You're this way or that way because the gene pool gets carried forth, I believe. Is that right? Is that what happens with us human beings?
Well, our genes haven't changed over the last 50 years, but America has gotten much more overweight and obese. So there's lots of environmental factors here. But I think if we focus on the question of prematurity, I think the risks for prematurity are quite substantial from all of those lifestyle and behavior issues that we really need to deal with, and our doctors can help.
So how do you, am I hearing, though, that you possibly go to a doctor a year or two before you're considering becoming pregnant?
We call that the preconception health visit, going to the doctor before you're pregnant in order to address these issues. And then during the entire pregnancy, of course, during prenatal care, one has to see the doctor quite regularly to continue to address the problems and to look for any signs and to learn about prematurity and the risk factors for preterm labor and the signs of preterm labor so that women can actually be part of the prevention mantra.
So now let's go to the doctors now. You know, I see, I mean, you're out here talking about this to increase education and awareness of this conversation. Would the doctor be surprised to get a call? You know, a call that, you know, you call because there's an exact reason. This is a discussion about that I want to become pregnant, say, a year or so from now. What are some things I should do? Does that make some sense?
It does, and the family physicians, the internists, the obstetricians who are taking care of the women of America applaud this kind of behavior. It's good care. So they will be able to do a full family history, a full personal history on the woman, do a full medical exam, and get that woman ready for pregnancy. I think that the doctors are prepared to do that and would be very pleased to do it. The problem, of course, is that we have to help the doctors to have good communication with the women. So women have to come to these visits prepared. They have to be thinking about what questions do I want to ask. And you know, at our website, marchofdimes.com, we have information for women who are thinking about getting pregnant, who are pregnant, or who are taking care of young infants. We even have questions that they can ask their doctors to help the communication, to help the doctors help them.
Mm-hmm. Be nice if there was some kind of a word or some kind of term that was put on this, that every woman who was thinking of getting pregnant said, you know, I should be going for my, you know, you have your annual checkups, you know what I'm saying?
Right.
And so people know that, you know, once a year I should go for an annual checkup. But in the world of pregnancy, I should go for my...
well, we call it, it's a complex word, but we call it the preconception health visit. Prior to pregnancy, preconception health visit. And the doctors are ready to do that. The women need to be focused on making themselves as healthy as they can in order to have a healthy pregnancy to get a healthy baby.
Okay, preconception, capital letters.
Right.
Well, because I think that, you know, I have a swordfish kind of baby, you know, daughter. I know my wife ate a lot of healthy foods prior. She ate a lot of healthy, you know, all kinds of, you know, kind of, you know, took care and physical. Because in addition to, you know, we're talking about the conception, but the conception of a baby is not an easy task, and physical, mental, emotional, and all those kinds of things, right, doctor?
Right, and every woman of childbearing age before they're pregnant and during pregnancy should be taking a multivitamin with folic acid, and that can help them to have a healthy pregnancy and to prevent both birth defects and prematurity. And I think, you know, we've done a recent survey that showed that moms and their doctors are really not talking about the signs of preterm labor. They're not communicating about risk factors about prematurity. And we need to increase that so that we can prevent preterm birth.
Well, wouldn't it also carry through? I mean, it's a physical, labor is physical as well. I mean, you need to be be able to carry, you know, 7, 8 to 9 pounds in your stomach. You have to then deliver, and it seemed pretty kind of physical, the baby coming out of a woman, right?
Well, absolutely, and we want the woman to be healthy. We know that it's hard work for women to be pregnant and to go through labor and have a delivery. So we want them to be healthy, we want them to be prepared, and we want them to have a pregnancy that's 39 or 40 weeks, which is the normal length of pregnancy, not preterm, less than 37 weeks.
What are some other things that are on marchofdimes.org?
Marchofdimes.org has information about any specific questions that women have about getting pregnant and about the preconception health visit, as well as preventing preterm birth, signs of preterm labor, and new approaches to preventing recurrence of prematurity, because that's a very high risk factor.
Okay, very good. Conception. Very good. Doctor, last question. What's good news for you?
Well, good news is that I think we can be optimistic that if doctors and women get together, they can do good to prevent prematurity.
Okay, fantastic. Thank you very much. It's always an honor, pleasure to speak with you. March of Dimes does a wonderful, wonderful job. And
Thank you, Paul.
Been on the helm there for a long time, and keep up the good work. However we can support you, we're here. Thank you very much.
Thank you.
Bye-bye.